The Doberman Pinscher is best suited to a suburban or country home with room to romp. They need a lot of exercise every day. This demand can be tiring to owners who aren't up to the job. They need a home with a securely fenced yard, for their safety and for the safety of people and animals who inadvertently walk into their turf. They should not be left alone for long periods of time or relegated to the backyard as an outside dog. They should not be chained either. The Dobie needs to be part of their family, participating in all family activities. The Dobie needs early socialization and training. Like any dog, they can become timid or quarrelsome if they aren't properly socialized when they're still young. Early socialization helps ensure that your Dobie puppy grows up to be a well-rounded dog. The public reaction to the Dobie is often one of fear. It's wise to be sensitive to this, and keep your Dobie leashed in public places. Feeding. Typical daily amount: 2.5 to 3.5 cups of high-quality dry food a day, divided into 2 meals. Note: how much your adult dog eats depends on their size, age, build, metabolism, and activity level. Dogs are individuals, just like people, and they don't all need the same amount of food. It almost goes without saying that a highly active dog will need more than a couch potato dog. The quality of dog food you buy also makes a difference. The better the dog food, the further it will go toward nourishing your dog, and the less of it you'll need to shake into your dog's bowl. Keep your Dobie in good shape by measuring their food and feeding them twice a day rather than leaving food out all the time. If you're unsure whether they're overweight, give them the eye test and the hands-on test. First, look down at them. You should be able to see a waist. Then place your hands on their back, thumbs along the spine, with the fingers spread downward. You should be able to feel but not see their ribs without having to press hard. If you can't, they need less food and more exercise. Coat color and grooming. The sleek, smooth Dobie coat is short and lies close to the skin. They may have a slight undercoat around the neck. Their coat colors are black, red, blue, and fawn. They have rust markings above each eye, on their muzzle, throat, and chest, and on their legs and feet. The Dobie's sleek coat requires minimal grooming. They're a clean dog, with minimal doggy odor. Don't be fooled by their coat length. The short coat does shed. Weekly brushing with a grooming mitt or rubber curry is sufficient, however, as is a bath when the Dobie rolls in something that smells bad or plays in the mud. Frequent bathing, however, isn't necessary. Brush your Dobie's teeth at least 2 or 3 times a week to remove tartar buildup and the bacteria that lurk inside it. Daily brushing is even better if you want to prevent gum disease and bad breath. Trim nails once a month if your dog doesn't wear them down naturally to prevent painful tears and other problems. If you can hear them clicking on the floor, they're too long. Dog toenails have blood vessels in them, and if you cut too far you can cause bleeding, and your dog may not cooperate the next time they see the nail clippers come out. So, if you're not experienced trimming dog nails, ask a vet or groomer for pointers. Their ears should be checked weekly for redness or a bad odor, which can indicate an infection. When you check your dog's ears, wipe them out with a cotton ball dampened with gentle, pH-balanced ear cleaner to help prevent infections. Don't insert anything into the ear canal, just clean the outer ear. Begin getting your Doberman used to being brushed and examined when they're a puppy. Handle their paws frequently. Dogs are touchy about their feet and look inside their mouth and ears. Make grooming a positive experience filled with praise and rewards, and you'll lay the groundwork for easy veterinary exams and other handling when they're an adult. As you groom, check for sores, rashes, or signs of infection such as redness, tenderness, or inflammation on the skin, in the nose, mouth, and eyes, and on the feet. Eyes should be clear, with no redness or discharge. Your careful weekly exam will help you spot potential health problems early. Health. Dobies are generally healthy, but like all breeds, they're prone to certain health conditions. Not all Dobies will get any or all of these diseases, but it's important to be aware of them if you're considering this breed. Von Willebrand's disease. An inherited blood disorder, this condition interferes with the blood's ability to clot. The main symptom is excessive bleeding after an injury or surgery. Other symptoms include nosebleeds, bleeding gums, or bleeding in the stomach or intestines. There is no cure, and a blood transfusion from the blood of normal dogs is currently the only treatment. Most dogs with von Willebrand's disease can lead normal lives, however. A vet can test your dog for the condition. Dogs with this condition should not be bred. Hip dysplasia. This is an inherited condition in which the thigh bone doesn't fit snugly into the hip joint. Some dogs show pain and lameness on one or both rear legs, but others don't display outward signs of discomfort. X-ray screening is the most certain way to diagnose the problem. Either way, arthritis can develop as the dog ages. Dogs with hip dysplasia should not be bred. Progressive retinal atrophy, PRA. This is a family of eye diseases that involves the gradual deterioration of the retina. Early in the disease, affected dogs become night blind. They lose sight during the day as the disease progresses. Many affected dogs adapt well to their limited or lost vision, as long as their surroundings remain the same. Hypothyroidism. This is a disorder of the thyroid gland that's thought to cause conditions such as epilepsy, hair loss, obesity, lethargy, dark patches on the skin, and other skin conditions. It's treated with medication and diet. Wobbler's syndrome. Suspected to be an inherited condition in Dobermans, affected dogs suffer from spinal cord compression caused by cervical vertebral instability or from a malformed spinal canal. Extreme symptoms are neck pain and paralysis of the legs. Surgical therapy is hotly debated, because in some cases the condition can recur even after such treatment. Cardiomyopathy. This is a disease of the heart muscle, which becomes thin and weak. It's characterized by an expansion or widening, dilatation, of the heart chambers, resulting in an abnormally large heart. This disease eventually results in heart failure, since the damaged heart muscle is too weak to efficiently pump blood to the rest of the body. Treatment varies but includes oxygen, fluid therapy, and medication that improves heart function. Albinoism. Albinoism is a genetic condition that affects the Doberman Pinscher. An albino is not just a white dog but a dog with pink skin and nose, and blue or light eyes. Albinos are sensitive to sunlight and can suffer from a variety of health conditions, including cancer and eye problems. Albino dogs should not be bred. Color mutant alopecia. This is a condition of the coat associated with blue or fawn coat colors. It affects blue and occasionally red Dobies. Most dogs who develop this condition are born with normal coats. Symptoms generally start to show up at 4 months to 3 years of age. As the dog grows and matures, they develop brittle hair, followed by patchy hair loss. Only the blue portions of the coat are affected. Secondary infection and inflammation is common. The condition is incurable, although medicated shampoos may help reduce scaling and itching. Narcolepsy. This is a neurological disorder caused by the brain's inability to regulate wake-sleep patterns. A dog with narcolepsy may suddenly become sleepy and in fact fall asleep. Research for treatment is underway. Gastric dilatation volvulus. Also called bloat, this is a life-threatening condition that can affect large, deep-chested dogs such as Doberman Pinschers. This is especially true if they are fed one large meal a day, eat rapidly, drink large volumes of water after eating, and exercise vigorously after eating. Bloat is more common among older dogs. GDV occurs when the stomach is distended with gas or air and then twists, torsion. The dog is unable to belch or vomit to rid themselves of the excess air in the stomach, and the normal return of blood to the heart is impeded. Blood pressure drops and the dog goes into shock. Without immediate medical attention, the dog can die. Suspect bloat if your dog has a distended abdomen and is salivating excessively and retching without throwing up. They also may be restless, depressed, lethargic, and weak, with a rapid heart rate. It's important to get your dog to the vet as soon as possible if you see these signs. Conclusion. The Doberman has a great deal of energy and needs a lot of exercise. This breed can be protective, so don't be surprised when they assume the role of household guardian. The Dobie will assume the alpha role in your household if you're not a strong leader. The Dobie is sensitive to cold weather. The Doberman Pinscher is a family dog and shouldn't be left alone. Are you thinking about getting a Doberman Pinscher? Let us know what you decide in the comments below. And if you know someone who's thinking about getting a Doberman Pinscher, please share this with them. If you liked this video, check out our website. The link is in the description of this video. Otherwise, have a great day. Thanks for watching. Don't forget to like and subscribe.